almost brand new. Only taken out Sundays by a little old lady from Pasadena.
700.
Oh, you kidding me? She cost us 2,100.
Oh, my God, I gotta go.
Hey, 1,500.
I'll be back Sunday.
That is AO, ma'am. This is info. Next, please.
Department of Surgery.
Look in the directory board, sir.
Where's the directory board?
Next, please. Can I help you?
Asoko.
ありがとうございます。
どういたしまして。
Here's your pass. Thank you. Bueno, señorita. Para la niña.
Good morning.
Oh, are you for maintenance? Listen, I called 4 times yesterday about that light fixture.
Oh, 2 shot.
No kidding.
I'm Dr. Durant.
Oh, I'm sorry, doctor.
All right.
I've got your info packet right here somewhere, Durant.
Durant.
You'll find everything in there. I hope. All the info you need. Let's see, your hospital bylaws, the laundry, the credit union.
What do I do about parking?
Well, you park in the space reserved for doctors only. Well, I'm not sure. They're not very friendly down in parking. They seem to resent anybody who wants to park.
Large, white, billowy cloud. The cloud is
Floating,
drifting along.
floating.
And you're drifting along
I'm
with
floating
it.
on a
Simply
cloud.
drifting along
Oh,
as you read,
hi,
relax. Drifting along.
MCR, metronome conditioning relaxation, developed by Dr. Brady from the University of Pennsylvania. Only way I can beat the stress. Hi, I'm Baxter. Hi. You're Durant. You're due about 15 minutes from now, from Hawaii, isn't it?
The wave I came in on ran ahead of schedule. I interned at Hawaii. It's my first day here.
Yep, my first day, too. By the way, you can call me Pete.
I'm Chris.
First day, but I spent the night here last night. The pad I'm supposed to be leasing isn't ready, naturally. I interned in Pittsburgh. Also did my first year of surgery there. I'm on anesthesia rotation this month, and you're first year general surgery, right?
That's right.
Incidentally, if I'm talking too much, it's because I'm compensating. Would you like to know what I'm compensating for?
I'm sure you got around to telling me.
I'll tell you. You see, when I checked in here last night, I hardly expected Klieg lights out front or a marching band. Oh, you got the bottom 2 drawers. But I've just got to say that I hardly was prepared for the crashing non-eventfulness of my arrival. You know, nobody seemed to care whether I'd gotten here or not. Makes you wonder.
About what?
Suppose I hadn't shown up at all. You think would have made any difference?
Only to you. Great fit, huh? Last of the spring line.
Say, have you seen the chief resident yet?
Not yet.
Want a tip? Before you do anything else, report into him. He's got a great welcome aboard speech, if you like speeches.
Where's his office?
Room 505. Can't miss it for the sounds of laughter. Hey, Chris. Welcome.
Thanks.
Come in. Where the hell you been?
I didn't think I had to be here till 7.
Technique of mine. The unjustifiable, unexpected personal attack. Throws the other guy off. Welcome to Dante's Inferno. We sure need the help. Please be seated. They show you where to sleep while you're on call?
Yeah.
You won't. Not around here. But it's a comforting illusion to know that somewhere a bed with your name on it does exist. Maybe you heard that there are thousands of open residencies in hospitals across the country. And such a crying need for new doctors that some people think no matter how inept, how stupid some of them turn out to be, we'll hold on to them, protect them, guide them through the obstacle course, then send them out, still inept, still stupid, to wreak their havoc on patients in private practice. Well, Durant, around here, and any other place I've been, no way. My mission in life this year is to flush out, expose, and exile any dum-dum who pretends he can make it as a surgeon and thereby diminishes the rest of us. Any questions so far?
None so far.
You'll find a whole galaxy of diagnostic tools in this hospital. Using them, you can obtain incredible medical intelligence about your patients. By using them, you can also kill those patients. I don't want anybody on this hospital staff using diagnostic procedures just to be gaining experience or academic completeness. Clear?
Yes.
You've got to be thinking, my God, when is this guy going to climb down off his soapbox and let me get back to work?
I started working when I came in the front door.
Okay, Durant. You've come here to learn. Every day in the wards, every operation, ideally, should be a small step forward on your way to becoming a better doctor. I'll do everything in my power to help you take that step. If you deliver, I'll go to the mat for you. But, and you've been warned, if you turn out to be a stumble bum, I'll ride you out of here before your first year's over. And that's a promise.
That's fair enough.
Good. Now let's get over to the wards. I'll take rounds with you this morning. I've scheduled your first surgery for 9:30. You'll be assisting Dr. Raymond Hutchins, cervical laminectomy. Doctor. Interns are Peterson and Kiefer. Peterson's a local, Kiefer's from Portland. You really have your work cut out teaching them.
Stumble bumps?
You have memory for words.
You use them so deftly.
God knows a white coat and a stethoscope never did confer instant wisdom, but these two will really challenge your ability. Miss Gunther, this is Dr. Chris Durant, the new resident in surgery. We were just on our way to meet you.
Doctor?
Miss Gunther?
We're late for rounds.
Dr. Curtis. Dr. Curtis. Please call 104 West. Dr. Curtis.
You think that's him? He looks like a boxer.
Oh, God, I'm nervous. I knew I would be, and I am. Dr. Bradley. Call for
Dr. Peterson? Dr. Kiefer? This is Dr. Durant, the new AR. Hi.
Hi.
Hello.
Hello.
Now let's get to it. Miss Gunther will carry the order book. Dr. Durant, you'll make out the cards. You'll make out a card for every patient in the ward, giving his name, hospital number, date of admission, diagnosis, summary of treatment. You'll keep those with you at all times, except, of course, when you're in surgery. At our evening meeting, we'll give them to whichever one of the senior men is running the session. Dr. Peterson, you and Dr. Kiefer can push the chart rack. I'll carry the scut book. Okay?
Dr. Escobar.
Let's go.
Dr. Escobar.
How are you today, sweetheart?
Wonderful, Doctor. Just wonderful. So much attention you'd think I was Princess Grace. I was just reading about her.
Oh, how's Grace doing?
Oh, she's up and around.
Dr. Keeler.
Dusting the palace.
Chart.
Good. Oh. Duodenal ulcer, gastroenterostomy. 6 days post-op. Soft diet, has passed flatus, but no BM. Wound healing well, sutures out tomorrow. Discharge anticipated.
Do vagotomy?
Usually do with gastroenterostomy.
Is it selective?
No. Well, this is Dr. Roberts' patient. He doesn't believe that the evidence for its value is conclusive.
What's a vagotomy?
On Friday, we will discuss the role of vagotomy in peptic disease.
Nobody's going to tell me what a vagotomy is.
You're looking fine, sweetheart. Maybe by tomorrow your husband can come and take you home. How about that?
Listen, who wants to go home?
Doctor?
Where else can you get a vagotomy? Which I'll never find out what it is. Sometimes it's better you don't know these things.
Painting a porch with Chappelle, sustaining corneal laceration. Distension, moderate drainage.
Okay, you take the first four. Proctoscope Anthony, Bradman on Harrison. Take the drain out of Maybury. Cross-match 3 units for Hayward. You got it?
Yeah, I think so.
Okay. Alec, you take the next 4, and then you alternate back and forth. You get all the patients done, okay?
Is there some shortcut? It's a bad word. I mean, so we won't be moving back and forth inefficiently?
I heard you the first time. Look, I'm as new as you are, so we got to find out together what works and what doesn't. Till then, you take your best shot. I'll be here for another hour to help you. Then I got to be in surgery. If you get hung up, don't be afraid to ask one of the senior residents.
Code
okay?
blue, room
Cardiac arrest?
327. Code blue,
One's
room
enough.
327.
Keep it, you take it.
Registered charge on 59 West. Call 133 West.
Dr. Hutchins? Bobby. Raise it to 4. Irrigation. Clap. Lap. Stitch.
The sponge and needle count is correct, Doctor.
Thank you. When we finish this roll, you may close the skin.
Want a sub-Q?
No.
How would you like it closed?
Interrupted mattress, 2-0 silk.
Cut. Skin. Do you tie?
Doctor, I'm Clive Olin.
Oh, I'm sorry. Walking away without saying anything. Guess I caught it from the inscrutable surgeon, Dr. Hutchins. I'm Chris Durant.
You thought that was Dr. Hutchins?
Yeah.
That wasn't Hutchins. I worked with him. That was him.
Well, there must have been a mix-up in scheduling. Whoever he was damn good. And I enjoyed working with you.
Why?
I worked with a nurse when I was interning who darn near broke my wrist every time she slapped a clamp into my hand. You do it just right.
Oh, thank you. Not for the pat on the back, but for noticing what you noticed.
Maybe we could get a sandwich later, hmm?
Oh, that wouldn't be wise.
Why not?
You really must be new here.
I haven't unpacked yet.
Oh. It's nice meeting you.
Oh, excuse me. Didn't you hear the page?
Oh, it's got out of surgery.
That's funny. I saw Hutchins with the family already. I thought you'd be with him, too.
Show me.
Show you. What?
Dr. Hutchins.
You just did an operation with him.
Yeah, I know I did, but show me. Come on.
Dr. Burrows, please call 125 West.
Let's see who...
Yeah, thanks.
Where?
On the left.
That's Dr. Hutchins?
You know how much he gets for an operation?
Are you sure that's Dr. Hutchins?
Yeah. Miss Gunther herself told me. Took one look at him and sent me back after you. Figuring you'd be out by now. We have a slight problem with a new patient. Well, actually, it's not really that slight. He won't let anybody near him.
Very successful. Okay, let's go see the patient. Hi.
Hi.
My offer's still good.
All right.
Lead the way.
She didn't waste any time.
Can't we keep her in the operating room?
What do you think she's doing now?
What's the food like here?
You have to be very hungry or very talkative or both. So you don't know what you're eating.
Report to surgery.
What do you suppose that is?
It's certainly a conversation piece.
Well, yes or no?
How about a maybe?
I'll take it.
To the desk.
I'll pass.
I'll gamble on the pie.
Well, that leaves carrot salad for me.
What can they do to a carrot?
Rinse it in Pfizer-Hex.
Dr. Kingman. Dr. Kingman, report to surgery. Dr. Mansfield, report to X-ray.
A tire stitch.
You're lucky today. It's usually a mysterious patty. Ketchup? That's the antidote for everything.
Wow. It's wonderful.
Dr. Kingman,
Tell me why I shouldn't be
report
seen
to
with you.
surgery.
It's bad for your image.
I don't understand.
Anybody seen fraternizing with me gets 10 demerits with the hospital administrator. You want 10 points against you your first day?
You may be a terrific surgical nurse, Clyde, but your communication, zip.
Well, let me put it this way. When I applied for a job here, I ran into one instance of sex discrimination after another. So I brought a class action suit against them, and it comes to trial next month.
You're suing the hospital? That's terrific.
Does it threaten you?
No, I'm threatened by so many things around here. You're suing the hospital amuses me.
Who are you to be amused?
Oh, I didn't mean it that way.
I know it. If you had it, I would have squirted ketchup at you.
What's all this about Hutchins?
What do you mean, what is this?
Well, I saw him taking vows with a family for that cervical laminectomy.
You mean you really don't know?
Well, what's to know?
Frankly,
What?
Dr. Hutchins has been known to miss more than one operation because of an overload on his schedule.
What's so special about Hutchins?
He's in. He's powerful, and in this particular factory, should and shouldn'ts don't apply to Dr. Hutchins.
But I saw him talking with the family. Well, is that some new kind of ghost surgery?
Well, I don't think I'd go that far.
Dr. Durant, cold case operator.
I gotta go.
Dr. Durant, cold case operator. Dr. Crane, report to the registrar.
Yeah, good anastomosis is caused by pressure on the headrest, it'll go away. But there's something else, and that looks like a deep retinal hemorrhage, mostly around the macula. Lynn, get a hold of the resident ophthalmologist and see if you can get the attending in. He may still be in the hospital. His name is Hutchins.
All right.
For the patient's sake, I hope I'm wrong. I'd like to hear what Hutchins will say if I'm right.
What are you talking about?
I think that patient in there might really have a damaged eye, and his attending, the eminent Dr. Hutchins, he didn't even do the operation.
You've been here one day. You've got 4 years to go. Don't rock the boat, Doctor.
You mean I shouldn't even talk about Hutchins missing his scheduled surgery?
That's exactly what I mean.
Well, who is he, God?
A reasonable facsimile. I see you doing that just once. Hitching rides on gurneys, with or without patients on set during...
nurse. I mean, I'm only here for tonsils.
I'm going to run your tail out of this hospital in 2 seconds flat. Understand?
Yeah.
Make sure you do.
Will the security officer please go to 133 West? Dr. Jackson, outside call. Dr. Jackson.
Where do you keep the coffee, Miss Gunther?
In the kitchen. Over there.
Enjoy me in a cup?
All right.
How do we make peace?
Did somebody declare war?
On the rounds this morning, you watched every move I made. You listened to everything I said, even what I didn't say. You're trying to make up your mind. What about this one? How am I going to treat him?
That's normal enough, isn't it?
It's too normal. That's what I want us to change. You've seen 1,000 residents come and go. You gotta resent that. You gotta be saying to yourself, if some new kid still wet behind the ears tries something on me, just once, I'm gonna make his life miserable.
I think you're overstating, Doctor.
I told you, Chris.
I'm a nurse, a professional, and I'm proud of it. There's nothing demeaning in my calling you doctor. It's only a nicety, an interprofessional respect. You can call me Katherine. You are overstating, Doctor. In this hospital, and everywhere else, as far as I know, all the orders are given by the doctors, not the nurses. So how can I make your life miserable?
I have to tell you? Count the ways? Okay, examples by being patronizing or combative, or by making damn sure that when I'm dropping on my feet for lack of sleep, you find one more crisis to pile on my shoulders when you could have done it yourself. Come on, Katherine. You know how much leverage you got.
Yes. I can make life unpleasant.
Mm-hmm.
Do you want to deny me the last of my inalienable rights?
No, I want to make a deal with you. No games. If there's something I don't know, or I'm not sure about, that covers a pretty staggering spectrum, and I figure maybe you do know, I'm going to ask you what you would do and not feel put down because you know and I don't. I mean it.
Are you for real?
Pretty heady stuff, huh?
I feel like I just sniffed ammonia.
Okay. Don't expect me to play Joe Cool, the swinging resident, with you younger nurses. So if you see me chewing one of them out, it's not because I've been turned down, it's because I'm a nut about preventing medication errors and cross-checking blood types before transfusions. All I'm trying to say is I don't want to compete with anybody. I don't want to play politics. One enemy's enough, disease. That's all I got time to fight. Will you help me? See you later.
Yes.
Can't see out of my left eye.
We're doing something about that, Bob. Right now, all you should do is just take it easy. Leave it to us. I'll be back in the morning.
Why can't I see out of my left eye? You operated on my back, not my eye. What went wrong?
Bob, the operation went off beautifully. I'm sure the pain in your arm will be gone. What we have to do now is just build your strength back. I'll be back in the morning.
Doctor. Doctor, please. Who are you?
I'm the surgical resident.
Why can't I see out of my left eye?
We don't know yet.
You don't know. Maybe you don't know, but Dr. Hutchins knows. Why won't he tell me?
Well, you're gonna have to ask him about that.
Where's he going? Why does he leave me here?
Excuse me. I'm Durant, doctor. I was the resident in surgery on your patient.
I know, Durant. I know.
Was he aware there was a possible risk to his eye?
I beg your pardon?
Before he signed the surgery authorization, did you inform him of the risks involved?
Are you questioning me, Doctor? Good night, man. What is this?
The patient's obviously a friend of yours, doctor.
Yes, we're old friends.
And he, along with the rest of his family, thinks that you performed the surgery on him.
Aren't you getting a little out of bounds with me, Doctor? What I do or don't do is my business. It's no concern of yours.
Dr. Kingman. Dr. Kingman.
You're asking me about the diagnosis, and I must be candid with you.
What do you got?
Head injury.
Bring Becky.
You do a skull series?
Not yet. Man, she just got here. I did a quick neurological.
And?
Nothing localizing. AO says she's a stripper.
Not a stripper, that's an exotic dancer.
Lock the gurney.
She put on a coat and went across the street for something. Some guy hit her over the head with a bottle.
Was she unconscious at all?
Near as we can tell, almost 15 minutes.
Well, she's down below 60. Get a hold of Gunther.
Good?
Get a hold of Gunther. Squeeze my fingers hard as you can. Squeeze my fingers hard as you can.
Miss Gunther. Yeah, can you come to ER?
How was she when she came in?
Both sides equal.
Not any longer.
Yeah.
Lift your knees. Here. Lift your feet. Okay, push against my hands. Get her socks on. She's weak all the way down on the left.
You want me, Doctor?
Call the senior neurosurgeon. Get a vein on her, Alex.
They're all in surgery.
For how long?
Well, too long to be of any help to this patient.
This can't wait. She's almost certainly bleeding intracranially, and she's deteriorating. She needs angiography, maybe burr holes. Can we call an attending neurosurgeon?
They won't come. Not until the neurology resident sees her first.
What about a radiologist?
He just started a pneumo on a child. There was a big fuss in admitting about her. The injury didn't occur on the job, so she's not covered by workman's comp.
Which makes it a staff case. Your case, Doctor.
This is neurosurgery. It's out of my league.
Haven't you ever treated a raised intracranial pressure?
And there's 10,000 other things I haven't done either. We've got to get that pressure off.
What about an IV mannitol?
Now, using it in a head injury is controversial.
Well, what are your options? You said she's deteriorating. Now, if we can just hold her until they can get her in surgery. Do you want to give her some Decadron, too, for good measure?
Okay, that's a good idea. 20% mannitol, Katherine.
Do you want her catheterized?
Yeah, put in a Foley.
You gonna let her talk to you that way, tell you what to do?
I asked her. What are you so surprised about? Did you learn anything in medical school? I'm not talking about what the distal convoluted tubule look like under a microscope. Did you learn any practical stuff? Okay, Alex, let's get cracking. Okay, urine, hemoglobin, white count. Bleeding and clotting time, BUN, electrolytes, typing cross-match, 4 pints. Skull series, chest x-ray. Okay, Alex, let's commit medicine.
Dr. Durant, CCU. Dr. Durant, CCU.
Over here. This is the patient's wife, Doctor, Mrs. Graham.
Hi.
I'm sorry he's making such a big fuss, Doctor.
You sit down and try and relax.
Here's his old chart. You see, he's just scared of doctors and hospitals. He keeps yelling that they're going to kill him.
3 heart attacks and a stroke in the last 10 years. Stokes-Adams attacks.
I can read. He's doing the killing himself.
But he won't listen. I mean, he just won't have another operation. Would you like some coffee? Have you got some decaffeinated? Appreciate it. Over and over again. All he says is, I just want to get out of here and get back to work. That's all I can think about.
If you don't need me,
Tell me what kind of work does he do?
Well, he was a truck driver, but now he's a dispatcher, and he works in an office. It took everything I could just to get him into the hospital. And now he won't sign that paper. He says that I tricked him to get him into the hospital. He says that if he lives and if he gets out of here, he's going to leave me. I don't know what to do, Doctor. I mean, I just couldn't let him die.
We'll try to see that he doesn't, Mrs. Graham. And when he gets out, had time to think about it, when he's back to normal, you know what he's going to do? He's going to put his arms around you and give you a big hug. Now, listen, I'm going to go in and explain things to him, okay? And you just relax.
Call the operator. Report to Dr. Andrews.
Terry? The size of a nose is a good indication. But his looks broken.
Mr. Graham? I'm Dr. Durant. I just talked with your wife. She's very worried about you. Not about the operation, because normally the surgery is no big deal, but you gotta be ready.
You guys. What I smell on you guys. I smell cemetery.
Nobody likes being in a hospital, Mr. Graham. I hate it myself, so let's get you out of here. As fast as we can, only feeling better, feeling good again. What can I say to you, Mr. Graham, that'll change that look in your eye when you see a doctor? You must think we're pretty strange animals, right? Well, let me tell you, Mr. Graham, I'm a man just like you. I got family just like you. Hey, listen, when I'm walking around here in my fancy white jacket, being the big doctor, you know what I wish? You're not gonna believe this. I wish I could see my mother again. She's, well, I lost her when I was 10 years old. But if I could see her again, just one more time, I'd put her in my car and I'd drive her up to the Big Sur. We'd have a picnic and we'd talk. I mean, all the things that I never even got to ask her. And I'd tell her how things worked out with me and what I think.
Now, Doc, you take off that white jacket. You'd make a good truck driver.
Right. Hey, I'll check in on you, okay?
Dr. Helmond, report to the resident doctor.
Hi, baby. Don't move now. Oh. Oh. Oh.
What's the matter?
I don't want to talk about it.
Good.
I almost fixed some poor man today. You know, I'm on anesthesiology rotation. Yeah, I told you that. I'm assisting Dr. Dorset on an emergency mastoid. So he tells me to intubate the patient. And I stick the tube in his esophagus instead of in his trachea, and I didn't recognize it. The guy could have ended up a head of cabbage. 4 years of medical school, a year of internship, a year of residency, 6 years of preparation. There I was, waiting for this poor slob. Hey. I'm sorry, I thought you were sleeping.
It's not a bad idea for both of us.
You think I can sleep?
Peter, you gotta learn to forgive yourself your mistakes.
Well, I guess that I have not yet learned to forgive myself some stupid, unforgivable mistake. The presiding Dr. Dorset simply said, next time, Baxter, watch out for those cords. I mean, onward and upward, right?
Think of a better direction? Durant? All right. Well, 5 minutes rest in 12 hours. Better than no rest in 12 hours. Of course, there's another way of looking at it. 12 minutes rest in 5 hours, better than 5 minutes rest in 12 hours. Especially if you divide by 5 and multiply by 12.
Dr. Bronson, report to the desk. Dr. Bronson, will the nurse on duty call the desk?
Dr. Durant.
Yeah.
Mr. Atkinson would like to see you.
Who's Atkinson?
The hospital administrator.
He wants to see me?
Mm-hmm. I guess he's got his problems, too. I hope you're not going to add to him. Not for his sake, but for yours.
How do I dress for the occasion?
Huh? Little sackcloth and ashes might help.
Where do I find him?
Where else? The penthouse.
Yes?
Dr. Durant is here.
Oh, very well. Send him in. Oh, and call my wife. Tell her I'm sorry I'm running late tonight. I'll be out of here in 5 minutes.
Yes, sir.
Oh, hello, Doctor. Come in. Close the door, would you, please? Come in. Sit down, please. It seems that we have developed a special situation today in regards to Dr. Hutchins and his patient, and you. I felt that it would be helpful if we discussed the situation. This is a city hospital, Doctor. Politics is something we all have to learn to live with. Now, my job is handling situations, so I'm not complaining. That's what I get paid for. But I hope that you're not going to make my job any harder than it already is. Would you agree with me so far? It appears that Dr. Hutchins' patient will probably lose the sight in his left eye. Now, that is a most unfortunate and regrettable accident, to say the least. However, there is every likelihood of a malpractice suit being brought, not only against Dr. Hutchins, but against this hospital as well. And if I know my legal brothers, I'm an attorney myself, they will name everyone even remotely connected with this case, such as yourself and 20 or 30 John Does. Of course, if that should happen, you understand that it's incumbent on you that you would reserve your opinions, your feelings for our insurance carrier.
In my opinion, sir, Dr. Hutchins violated his duty to his patient.
Oh? How?
By having another surgeon do the work, and possibly by failing to warn the patient about the risk of blindness.
On your second point, there's another side to that. The age-old question, should the doctor tell his patient everything and run the risk of frightening him out of a critically needed procedure, or so spooking him that he might become a poor surgical risk? As you will learn, most patients don't want to hear the grisly details. They would rather leave those areas to the doctor.
I'm sorry, sir, I don't agree. It's the patient's body, it's his life, it's not the doctor's. I believe the patient himself should have the final decision.
Well, that is one point of view, but there are others. Besides, this kind of an incident is not one which is a recognized complication. And on the other matter, the surgeon of record, Dr. Cheng, was listed on both the OR schedule and the surgery consent form, along with Dr. Hutchins. So you see, if there is any inquiry, just refer it to me. And good night, Doctor. It's nice having you with our staff.
Skin was closed with a running 5/0 nylon suture locking each stitch. There were no complications. Estimated blood loss was less than 400 cc. Please send a copy of this to Dr. Hills. Thank you very much, Dr. Zane. Atkinson told me he was going to talk to you.
He tell you what he was going to say?
What else could he say?
What was all that this morning? About weeding out the stumble bumps. Was that only for us residents? What about the fat cats? The eminent surgeons, they above reproach?
They pay their dues.
And we haven't?
You haven't even scratched the surface. And I'm only 3 years farther down the road than you. And Hutchins is 25 years past me. Are we to challenge him?
Why not?
Look up his record sometime, Durant. He's been one of the top men in his field. I respect that.
You're painting a pretty strange picture.
What's that supposed to mean?
Well, what have we got to look forward to? Doctors becoming corporations? The idea that money outweighs personal care and superstars commanding big fees because they got the mileage?
Come on, Durant. Don't blow this thing up into what it isn't. The man was late. And he didn't send a butcher in to substitute for him.
I know Cheng took over, but that's not the point.
What is the point?
Wesco was Hutchins' patient. And Hutchins knew the man's case history intimately and was the one who would have been most knowledgeable about any possible complication.
Want a cup of coffee?
No.
You know something? Both of us are called upon to play God every day, and neither of us is qualified.
That's a relief.
Get off your white horse, Chris. My concern is not an isolated instance in this hospital. It is the hospital. Like other human institutions, this one is nakedly imperfect, but it is the only one we have. You want to make improvements? Good. So do I. But give them time, and let them come from within. How else are we to learn to do except by doing? And by doing, accomplish the one thing we both want most, save lives. Face up to reality, friend. Unless, of course, you just want to cut out hemorrhoids for the rest of your life.
Is that it, Doctor?
That's it. Doctor.
No cardiac arrest, doctor. I was told by the attending that we shouldn't call a cardiac arrest.
Has he had Demerol tonight?
Yes, ma'am.
Could be that. Demerol. Thin old man. Just after deep anesthesia. The combination could produce respiratory depression.
You know, he's the first patient directly under my care to die.
Dr. Durant, please. Hello, Chris. This is Lynn. The old man died. The gastric CA.
So an old man died, so what's the problem?
Oh, well, no problem, actually. But would you mind coming over and taking a look?
Look, Lynn, he's dead, right?
Right.
So, what do you want me to do? Perform a miracle?
I'd appreciate it if you'd just come over and have a look.
All right.
Was it the Demerol I gave him?
I'm sure he was grateful that you gave him the Demerol.
Thanks.
It's okay.
Dr. Terry, report to obstetrics.
What's going on?
Well, I know he's dead. But I keep having this fantasy that any minute he's going to sit up and laugh at me, and it's all going to be a big joke.
You called me down here for that?
What else could I have done for him? Tell me that.
Not a damn thing. As it is, he lived longer than they predicted.
I could have massaged him. Maybe that would have kept him alive a little longer. I mean, one minute he was alive, apparently doing fine, and then the next minute he wasn't.
I can tell you when he died when you pronounced him dead.
Well, that's what's troubling me. The minute I make that decision, all the medical doors go clang. We turn off the machines.
They need the beds. Look, he was riddled with CA. He took the easy way out. Would it make you feel better if you could wake him up so he'd die in agony a week from now? Look, call his doctor and tell the family. We're going to try and get an autopsy, okay, Lynn?
Chris, do you mind if I get personal?
Okay, get personal, then I'll tell you if I mind.
When I met you this morning, I had a good feeling. I thought I was going to learn a lot from you.
So far, I don't mind.
Well, now with this old man, you talk about him as though he never were a human being. Well, I'm just wondering if that's what the system does to us. Is that the way I'm going to be a year from now?
Not if you decide to drop out first and become a plumber. Hi.
Hi. Be a lot easier if she just said yes, wouldn't it?
Toxemia of pregnancy?
Perish the thought. I'm taking some night courses in med school, family medicine.
That surgery we did for Dr. Hutchins this morning, the cervical laminectomy, that patient is going to go blind in one eye, and everybody's covering for Hutchins in case there's a negligence suit. And I've been asked, no, told, to shut up.
So shut up.
Well, you didn't. You're suing the hospital for discriminating against women.
They can't afford to fire me. They only make my suit more binding. Well, they can weed you out in 1,000 ways, and none of them traceable. Chris, if this'll help you any, all I know about Dr. Hutchins...
What?
There are times that Dr. Chang, a Dr. Chang, does his work for him, and nobody's the wiser.
So that's it.
Well, Dr. Chang works for Dr. Hutchins. You want to end up giving shots to kids in a Saturday clinic out in the boondocks? Chris?
I've done it before.
Dr. Kingman, report to surgery.
Chris, Dr. Kiefer's looking for you.
Now what?
Well, he didn't say. I guess he figures I have enough problems of my own. Hey, look, I'm sorry about that outburst.
What outburst?
The stomach cancer, the old man who died.
How'd it go with the family?
Oh, that was something else.
What do you mean?
Well, they just stood there waiting for me to lay it on them. No hysterics, nothing. Actually, it was kind of a letdown. I expected more.
Yeah, I know. Most people, they go numb in the presence of death. If anything, they become more civil. That's the one thing about dying. It's about the most ordinary thing you can do. Hey, listen, you don't have to apologize for what you said to me. You go into the machine rough, you come out smooth. It's the only game in town.
I don't want to believe that.
I didn't want to believe that either.
Dr. Durant, call page operator. Dr. Durant, call page
You know, there's got to be a way to beat it.
Lynn, I don't know any more than you do. Except, try not to let him wear you down. Hi.
Hi. Have a seat. My turn to pour. Black?
3 lumps.
Dr. Hines, outside call. Dr. Hines, outside call.
I must have missed the punchline.
I'm just laughing at myself.
Hmm?
I'm getting so involved for a guy who just got here. I'm getting punchy.
Here. Sit down and drink this. And I think you'd better go and lie down. You've had it.
Are you kidding? I haven't even worked 24 hours yet.
Dr. Curtis, please call 104 West.
What's wrong?
Talk to me about Hutchins.
You're not going to start that again, are you?
Yeah.
Well, I've known him. I've worked with him for nearly 15 years.
It's a long time. You buy the telephone operators boxes of chocolates on Valentine's Day?
Things like that, yes. And he's an excellent surgeon.
So I've been told.
He is.
And he's wealthy, too.
Very.
Where do you think he was this morning?
What do you mean?
When he missed the surgery. Early morning golf date, another woman?
Well, I think things got very busy at Park Hospital.
What's that?
It's a small hospital in the suburbs near where he lives, and he owns it.
He operates there?
Yes. And I think he was probably operating there this morning, and something happened. Maybe the surgery took longer than he anticipated.
And at the same time, abracadabra, he's performing surgery here.
Dr. Cheng performed the surgery here.
And Dr. Hutchins is a little bit richer for Dr. Cheng's capabilities. It's happened before, am I right?
I guess.
Well, doesn't that bother you? Doesn't that stink a little? The facade, the lying, the greed. Where does that all end?
I try not to sit in judgment on people. I used to. When you get to be my age, maybe you relax a little. Maybe you get tired. Maybe you see too much. I don't know. What's right, what's wrong with the world, I don't know. This place is my life. Why don't you go lie down for a while? You've got 2 interns that look after things for you.
problem is, this is neither the time nor the place for it, Dr. Durant.
We're better than among our fellow healers. Coffee. Morning.
Hi, Chris.
For those of you who are new here, I'm John Bryce. Every Tuesday morning at this time, we hold these mortality and morbidity conferences. It's Dirty Linen Day, but these are learning sessions, not courts of condemnation. All right? Who's first?
Dr. Andrews.
Patient is a 12-year-old Caucasian male, 72 pounds. He was admitted 5 days ago for tonsillectomy and laryngotomy. Apart from recurrent bouts of tonsillitis, he was in good general health and had no significant past illness. The temperature rose to 108, then drifted down as the patient was packed in ice. 3 hours later, he was still comatose with fixed dilated pupils. Although the temperature stabilized at 96 degrees and he was markedly acidotic, in spite of supportive treatment, he went unchanged for the past 5 days until he died this morning. I can only assume it was a defect in his hypothalamus, and that the anesthesia itself brought on the fever attack, and his temperature control gland failed.
Comments?
How can you predict something like that?
Assuming no prior history of hyperthermic difficulty, I don't see how you could possibly have anticipated that development, Andy. Questions, comments?
Dr. Bryce, we've decided to hold a special conference on this subject next week, and we've invited Dr. McGraw from University Hospital to be our discussant. He's recently published a review on this matter.
That's an excellent idea, and I'm sure we're all looking forward to that. Anything else?
Dr. Baxter.
The patient was a 26-year-old male Caucasian, 158 pounds. He was admitted yesterday morning for an emergency mastoidectomy. The patient was induced with an ectine and pentothal, and I passed an 8mm endotracheal tube under direct vision. I was so sure that it was in the trachea that I connected the ventilator and began to write up my chart. I guess I forgot to check his chest movement. Dr. Dorset had been busy putting in another IV because the first one had infiltrated. When I noticed the patient a minute or so later, he was cyanotic. I ventilated the patient with oxygen, and his color rapidly improved. I can't explain it. There's absolutely no reason to make a mistake like that. I've done dozens of endotracheal intubations before.
Comments? Dr. Dorset?
A mechanical device is no substitute for vigilant eyes and brain. The patient's respiration and other physical signs must be checked constantly, regardless of what is indicated by electronic or other monitors. Fortunately, in this case, the patient did not have to pay the price of brain damage, or worse.
Next. Anything else?
Dr. Bryce?
Yes, doctor.
Post-op blindness resulting from a cervical laminectomy.
I'm familiar with that case, Doctor. The blindness is not yet conclusive. I think we can hold that off till next week. Gentlemen, anything else?
No.
Well, then I'd say we've had a superlative week. Thank you for attending.
Yeah, that'd be great.
I'm sorry to have ridden over you like that, Doctor. I felt for your own good it was advisable.
Doctor, I'm being asked to do something against my training, against my principles. I'm being asked. to ignore the fact that one of this hospital's attending surgeons may have caused a patient the loss of his eye.
Dr. Hutchins is one of our most important contributors in any number of ways. You beginning to sense the complications, Doctor?
I know I'm going to have to bend, sir, but I'm damned if I'm going to break. Now, this issue, Dr. Hutchins' irresponsibility to his patient, that's a make-or-break issue with me. And if the system covers up a dereliction like that, then I'm going to have to make up my mind. Either I'm in the wrong profession or I'm in the wrong hospital.
Don't you ever again lay an ultimatum on me. You make it very tempting for a man to say yes. You are in the wrong profession.
Why do they always walk away?
To avoid strangling you.
Defibrillator. Breathe it, honey. 1. Get the head out. 2. Off and the head out. Ambo bag. 5. Breath. C1U. Cold blue. C3U. 4. Get that board for me, will you, honey? 3. 4. That's the oxygen. 5. Feel those trembles, will you now? 1. 2. 3. 4. 5. 1. 2. 3. 4. 5. Take a good. 3. That's the whole body. Oh, we have a ventricular fib, Doctor. The paddles are charged and ready, and it's set at 300 watt seconds.
Hands up. The switches are shot. Give me another set of paddles. I better tube it. How long was he pulseless?
30, 40 seconds at the most.
Push an amp bicarb. All right, take him off. Off. Try 400.
400, Doctor.
That's better.
That's a lot better.
Okay, that's a good pulse we got him back. You can push another amp of bicarb. You people sure do know your jobs. What am I doing here? This is not my bag. Where's the cardiac surgeon?
I'm sorry, Doctor. We're paging him. He's probably on the elevator. Sometimes, you know.
As they say, we meet again.
As they say.
Dr. Bernard, report to the desk.
Come in.
Dr. White, call the operator.
I hear you're very upset with me about Robert Wesco.
That's right, Doctor.
It's my case. The man is my friend. Now, don't you think it's my concern? Totally. And no one else's.
I keep asking myself, did your patient, your friend, get his doctor's...
His doctor's what?
Total commitment.
I see. You're asking questions. Well, I don't think at this stage in my life I have to account to you. Oh, I respect your youth, your ardor. There's a word I haven't used for years. If I didn't respect them, I would have you up before the committee and out of this hospital. I don't think you would like that very much.
Well, whatever happens to me, Mr. Wesco is going to lose part of his eyesight.
I'm aware of that.
And don't you think that if you were with him in the surgery, that things might have been different?
No, I doubt it very much. There are other factors, you should know this, which have to be considered and weighed.
I know the possibility of the anesthesiologist's error. I know that, Dr. Hutchins, but you were not present, Doctor. And you know your patient better than any other doctor. And maybe you could have foreseen the complication.
I might have foreseen it, but we're talking about 1,000,000 to 1 shot.
But don't you think you owe your patient that one perhaps?
I can understand how you feel about me. I remember feeling the same way a long, long time ago.
happened to those feelings?
If I started to analyze that, to review the perhaps thises and perhaps that's, which are a part of my career and my life, I'd end up in a straitjacket. Is that honest enough?
Yeah. We're doctors, and I think that all of us are becoming so busy and so overextended that we're losing track of where our obligation begins and ends toward the patient.
What are you, Durant? A righteously angry young man? Or are you just looking for trouble?
I'm looking for truths, Doctor.
All right. The truth, I did nothing wrong. I did nothing that hasn't been done, nothing that won't be done again. It so happens that I don't deal with ethics and values. I happen to deal with realities, not catchphrases. And I suggest that you learn to deal with them too. Otherwise, and you can believe me, they'll break you here. Survival. Tattoo that word to your ardor, and you might make it.
Dr. Hutchins, there has to be something better for me than just survival.
Sweet smell of carbon monoxide.
Anybody like to meet my wife? Another time. Okay. Well, see you in the morning.
Will you lift?
You think I want to end up in a hospital? Thanks, I have my car here.